Well, toward the end of the last legislative session, one of the last bills lawmakers passed was the 2024 Medicaid budget. It wasn't an easy one. Their first attempt failed in the House. Then the budget writers trimmed about $150 million from it. And they did that knowing that wasn't all that was going to get cut from Medicaid in Idaho. Who gets access to these benefits is about to drop by about 150,000, give or take. When the COVID pandemic prompted a public health emergency to be issued in January of 2020, well, that sparked Medicaid protection, meaning people were not allowed to be dropped from Medicaid coverage, even if they were no longer eligible. That protection ended April 1st. So now Idaho's Department of Health and Welfare is in the process of auditing its Medicaid rules and dropping those who no longer qualify. They're reviewing about 150,000 cases. And maybe you're one of the nearly 19,000 who have already been dropped. What now? Joe Paris tries to answer that question.
Inside Idaho's Department of Health and Welfare, there is heavy lifting on intricate data, specifically on Medicaid.
Right now, we are unwinding.
Shane Leach is the administrator of the Division of Welfare. He says with Medicaid rules in place, the state saw more and more people join Medicaid.
So starting in 2020, our enrollment went from about 300,000 up to 450,000 participants. Starting here recently in February, with the end of the public health emergency, we have now started the process to do renewals on all those individuals to see if they're still eligible for coverage or not, because we were unable to disenroll them during the pandemic.
So yes, 150,000 people on top of the normal rolls. So if you're on Medicaid, Idaho is working to confirm that you're still eligible.
These are individuals we're trying to get in touch with. We want them to contact the department. They need to do a renewal. If they don't complete a renewal, they could risk losing their benefits. We do it over the phone, collect their information, current income information, where they work, family size, household composition, other information. We take that, process that, and determine the eligibility.
Idaho lawmakers drew attention to Medicaid enrollment and costs during the most recent legislative session. Some lawmakers were hoping to see enrollment dropped in a significant way, which could lead to savings for Idaho. So far in their evaluations, out of 153,857 total people in Medicaid protection, 48,005 reevaluations have been processed, 18,980 people are eligible, and it's been found that 29,025 people have been determined ineligible. But lawmakers still need to be patient with final numbers.
It's a lot of work and obviously requires the involvement from our participants, right, to go through and complete the renewals. I think we have a really good planned out time frame. Other states are a little bit different. Some are taking longer, some are sooner. We started right away based off those kind of different factors, right, that apply to that to make sure people are still eligible. We're working closely with our federal partners.
Health and Welfare wants to get everyone looped in to make sure that Idahoans understand what they are doing right now. You'll receive mail from the department about your status and renewal. It's not a scam. They need to hear from you.
Get in contact with us, number one. Again, we start the process 60 days before to see if people are still eligible or not. So the initial is send them a renewal form. At day 30, we send a reminder. We're also currently working on sending individual text messages as well before the end of the month when they could lose the benefits if they don't get in contact with us. So sooner the better.
What happens if you're found to be ineligible? You still have health care options.
Overnight, they will actually be transferred to our partner, Your Health Idaho, which is a state-based marketplace. So from there, they will have an option where the state-based marketplace will actually reach out and potentially provide them additional coverage if they want to go shop on the exchange.
So I know we heard from some Idaho lawmakers during the legislative session saying that we'd like these answers now. We want to know how many people are really going to be on the Medicaid rolls as we examine the budget. And Brian, in terms of when will those numbers be available, it looks like July. And I just want to be very clear that the team that's working on the audit here and that's really working on the enrolling and the unrolling, they do other things at the Department of Health and Welfare. They work with a lot of the programs and confirm eligibility, things like food stamps, SNAP, things like that. So that's why it's taking some time, is because they have 300 people that are working on this, but they have other things to get done as well.
All right. Thank you very much, Joe.